Hi, I'm Dr. Scott Stoll. As a part of disclosure, there's no actual or potential relevant financial disclosure. Our course outcome objectives are to describe the criteria for the remission of type 2 diabetes, classify the lifestyle factors that contribute to type 2 diabetes remission, discuss the physiologic changes that restore insulin sensitivity, and list 4 or more essential components of an intensive lifestyle intervention that will maximize the potential for remission. Definitions are important, and as we look at the definition of remission, we will utilize the ADA consensus statement. According to the statement, diabetes remission occurs when the hemoglobin A1C is less than 6.5, measured for at least 3 months after cessation of glucose-lowering pharmacotherapy. If, however, the A1C is less than 6.5, and it's not a marker of reliable glycemic control, then we'll use the FPG less than 126 milligrams per deciliter. And it's recommended that over the course of time, there continue to be active observation and ongoing support for any patients that have undergone remission, because there still is a risk with the return of lifestyle factors that diabetes could return. Now, as we talk about remission and reversal, it's important to understand that type 2 diabetes is really a multifactorial disease. There's an epigenetic inherited susceptibility that is really manifested through environmental exposures and lifestyle choices. And herein lies the challenge with remission and reversal, that it is the activation of this epigenetic sensitivity through diet, exercise, stress, and habits, but it's also impacted by the environmental changes of an individual that include changes or alterations in their microbiome. In some cases, it's medications like corticosteroids used to treat different conditions, including some of the autoimmune conditions. It's culture and relationships that also impact type 2 diabetes, as we see today in many places where the food deserts don't allow free access to affordable, healthy foods. As we get started, I just wanted to share a case that one of my patients through the years, I've been practicing lifestyle medicine for about 17 years, and have seen many, many cases of reversal of type 2 diabetes, sometimes dramatic. Jose is representative of a population of my patients that have come to see me through the years, and he was a 57-year-old male with about a 10-year history of type 2 diabetes and a 2-year history of very painful diabetic peripheral neuropathy. He had significant pain at night, which disrupted his sleep, and he would describe pain in his feet that really limited his ability to walk or maintain activity. He was wearing diabetic footwear to protect his feet and had a significant amount of pain. In the middle of the night, he also had back pain that would disrupt his sleep and became an issue in any exercise interventions. He had been prescribed metformin 1,000 milligrams twice a day and gabapentin at bedtime for his pain. He was reporting side effects from the gabapentin that included some increased weight gain and depressed mood. The benefit from the gabapentin was really limited. Jose was describing morning drowsiness due to the gabapentin, and he was frustrated and hopeless because he had tried many times to improve his lifestyle and lose weight. And in fact, many previous attempts at weight loss, including dietary interventions, group weight loss programs, had not brought significant change in his life. And by the time he had come to see me, he was considering gastric bypass surgery in an attempt to overcome his current challenges. However, after I shared with him the potential benefits of a lifestyle intervention with whole food plant-based diet and the possibility of actually avoiding surgery and some of the long-term complications of gastric bypass surgery that we've discussed in previous section, Jose said that he was willing to jump in and try a lifestyle intervention. And he had some restored hope that this actually may give him an improvement in his quality of life and the opportunity to discontinue medications. Moved with some motivation and hope, Jose jumped in, and after 2 weeks, we were able to reduce his metformin to 1,000 milligrams a day, so basically cut his medication dosage in half. After 4 weeks, his blood sugars had normalized to the point we were able to discontinue metformin, and he was reporting a significant improvement in his diabetic peripheral neuropathy, and we were also able to discontinue the gabapentin. This obviously improved his morning drowsiness and improved his mood, and he was very excited about his progress. Now, with an improvement both in his diabetic peripheral neuropathy pain and his back pain, he was able to begin walking and hiking, and over the course of 8 weeks, lost an additional 20 pounds. Today, Jose is medication-free. His diabetes has been reversed. He has a normal weight and a very healthy life, and was able to avoid surgery, and now is not just healthy, but an advocate for lifestyle intervention for all those that he meets. So as we think about some of the mechanisms that are involved in the development of insulin resistance, like in Jose's case, it's really important for us to understand that, we're going to talk physiologically about the mechanisms of insulin resistance. However, it really begins with some of the influences of our choices on a daily basis. And this includes a culture where we have highly processed, hyperpalatable foods that stimulate our reward system. We have abnormal hunger signals from nutrient deficiency and cravings associated with the hyperpalatable foods. Stress and emotional eating certainly play into food choices. We have busy schedules. We have a society built around convenience and immediate gratification. We have also cultural challenges with skills and lack of training, and a culture that really values the immediate reward of taste over health. And so those are the outside or external influences that begin to influence choice. And when we change choice and we change the food that follows choice and the lifestyle that follows those choices, then we begin to see some of the internal physiologic changes associated with insulin resistance. And in this slide, we see beginning in the diagram that there's this genetic predisposition with polymorphisms associated with the susceptibility for type 2 diabetes. And then we have the lifestyle factors that we talked about earlier. Over time, there's the peripheral insulin resistance that develops through inflammatory cytokines, oxidative stress. We have alterations in the metabolism of the liver through reactive oxygen species, inflammatory cytokines that begin to create insulin resistance at the level of the liver. This results in an increased glucose production. At the same time, as we'll see in just a minute, there's the development of insulin resistance in the skeletal muscle due to intramyocellular lipid accumulation and disruption of insulin signaling. And as the individual gains weight, the adipocytes begin to increase their production of inflammatory cytokines, also creating a problem with insulin resistance globally. It's a multi-site issue that really stems from those original choices, lifestyle factors, and genetic susceptibility. Now, in this slide, we're looking at the starry sky. The starry sky here is really a cross-section of skeletal muscle, and the iridescent green are the intramyocellular lipid accumulation within skeletal muscle. And this is a distinctive feature of insulin resistance, and it really represents disrupted insulin signaling. We also see in insulin resistance a disruption of leptin with elevated leptin levels. And this is similar to what's observed in chronic inflammation with chronic elevated leptin and its association with obesity, overeating, and chronic inflammatory diseases like hypertension, metabolic syndrome, and cardiovascular disease. And so, it's a global disruption of not just internal insulin signaling within skeletal muscle, but alterations of more systemic hormonal balance, including leptin. Now, intramyocellular lipid, as we just saw in that last picture, is important because as it accumulates, it begins to modulate insulin sensitivity via a disruption of intracellular signaling mechanisms through the production of inflammatory cytokines, the alteration of extracellular matrix proteins. It's disrupted through increasing local free fatty acid concentrations and is involved in the regulation of perilipin 5 gene expression, which is directly related to insulin resistance. Now, if we look just for a minute at normal insulin signaling and sensitivity, we can see that insulin binds to the insulin receptor and opens the channel for glucose to enter into the cell. In this first image, we see a very small amount of intramyocellular lipid, And we also see just to the left the glucose 4 transporter, which is activated and opens up to allow glucose to enter. As we'll see later, and just as a point of recognition in this slide, the glucose 4 transporter is also activated through exercise independent of insulin. And so that becomes an important mechanism in the regulation of insulin sensitivity. We can see here in this slide that there's a multi-site disruption resulting in a lack of insulin sensitivity and this progressive insulin resistance. And we see disruptions by the intramyocellular lipid of the insulin receptors and the mechanisms leading to the opening up of GLUT4 transporters and the entrance of glucose into the cell. The slide is just to highlight that it's a multi-site, multifactorial challenge that comes as a result of this intramyocellular lipid. We also see that insulin resistance is activated through inflammatory cytokines and saturated fatty acids that come directly from dietary contributions and the adipocytes. We see disruptions from hyperglycemia leading to endoplasmic reticulum stress and the alterations of the inflammatory pathways. These interact on this insulin receptor substrate, the IRS1 and 2, which are critical regulators of insulin signaling. It's also been shown in studies that these IRS1 and 2 are important in endothelial cell function and have been. We also see that insulin resistance is activated through inflammatory cytokines and saturated fatty acids that come directly from dietary contributions and the adipocytes. We see disruptions from hyperglycemia leading to endoplasmic reticulum stress and the alterations of the inflammatory pathways. These interact on this insulin receptor substrate, the IRS1 and 2, which are critical regulators of insulin signaling. It's also been shown in studies that these IRS1 and 2 are important in endothelial cell function and have been related to diseases like cardiovascular disease, dementia, and retinopathy. So this disruption through saturated fatty acid cytokines, hyperglycemia, hyperlipidemia have significant impact on this IRS1 and IRS2 signaling molecules and contribute to some of the secondary disease processes associated with type 2 diabetes. Secondarily, this whole inflammatory cascade, including NF-kappa beta, is upregulated, and NF-kappa beta is related to the activation of 400 different genes in the inflammatory cascade. And so once that switch has been turned on, there is a progression of inflammation which is related to insulin resistance. So some of the more basic physiologic changes that we begin to see after the activations of these biochemical changes, we see a gross and global effect on insulin resistance. And so as we're talking about remission and reversal, we're looking really at a normalization of A1C and a normalization of insulin sensitivity through an intervention that normalizes all those biochemical changes. We would essentially see a reduced intramyocellular lipid and hepatic lipid count, reduction in oxidative stress and normalization of the endoplasmic reticulum, reduced inflammation, and improved mitochondrial function. So it's important to recognize that diabetes, type 2 diabetes, is a multifactorial challenge. And so it often takes a multimodal intervention to maximize the potential of improving insulin sensitivity and reversing insulin resistance. Yes, it is primarily diet and lifestyle. However, we need to address the environmental challenges, the stress, the relationship, sleep, and habits that would play into that full solution and help to create a sustainable lifestyle. And so the dietary intervention trials that we'll be discussing, primarily they're looking at the more important components like food and exercise, but a part of a comprehensive, sustainable solution needs to take into account the other critical components of a sustainable lifestyle. So let's just spend the next few minutes taking a look at some of the more recent dietary intervention trials that have utilized intensive lifestyle intervention for the reversal or remission of type 2 diabetes. We're going to be taking a look at a number of studies that have utilized this intensive lifestyle intervention as characterized in the literature. And I want to point out that these intensive lifestyle interventions are perhaps not to the degree that the American College of Lifestyle Medicine would utilize a lifestyle intervention. However, it gives us some understanding of the power of lifestyle intervention. In one of the largest and longest reported lifestyle intervention trials, the Look Ahead trial recruited 5,145 overweight adults aged 45 to 76 years old with type 2 diabetes at 16 different U.S. research centers and randomized them either to an intensive lifestyle weight-based intervention with counseling or the diabetes support education intervention. They had yearly clinic visits in follow-up to assess their improvement. The intensive lifestyle intervention aimed to reduce total caloric intake to between 12 and 1,800 calories, depending on the individual. And they focused on reductions in saturated fat, as well as an increase in physical activity to 175 minutes per week. They did utilize liquid meal replacements to assist in the dietary goals. And so this trial found in their conclusion that in these exploratory analyses of overweight adults, an intensive lifestyle intervention was associated with a greater likelihood of partial remission of type 2 diabetes compared with diabetes support and education. However, the absolute remission rates were modest, and they found partial and complete remission rates of 11% at 1 year and 7.3% at year 4. They also identified greater weight loss and greater fitness outcomes through the intensive lifestyle intervention. However, studies like this fail to recognize the multifactorial issue, and therefore the outcomes of remission and reversal are really reduced. Intensive lifestyle intervention is not just education, it's not just counseling to make better choices, but it really is an intensive remodeling of a diet and lifestyle, focusing on the foods that have the greatest opportunity to reduce intramyocellular lipid, inflammatory mediators, and change the physiology at the greatest degree. And I think that as we see through the literature, this intensive lifestyle intervention has some modest benefits because they're not utilizing the most potent antidotes for type 2 diabetes, those focused at improving the biochemical changes of insulin resistance. Here we see some of the graphs from this study, and both groups received guidelines here, and we see that the group that received the intensive lifestyle intervention had relative improvements in all of the markers, inflammatory markers, weight loss, and lipids, as well as improvements in BMI, blood pressure, hemoglobin A1C, and serum HDL levels. And we also see that inflammation, including IL-6, TNF-alpha, were reduced, and in the intensive lifestyle intervention group, renal function was also improved. And so it gives us confidence that at least at some level, an intensive lifestyle intervention is successful. And I believe that the more intentional we become at helping our patients modify their diets and improve their exercise and stress and lifestyles, we will see even greater degrees of changes in these markers. Now, it's interesting if we consider that some of the studies are looking at weight loss as the primary means of alteration in insulin sensitivity. There was a study done in 1979 that looked at this question of whether or not weight loss is the primary mechanism of improving insulin sensitivity. And they took a group of patients and put them on a 16-day interventional trial with a high carbohydrate, high fiber diet, essentially a plant-based diet. And they controlled for weight. They assured that no one would lose weight during the study. And if people started to lose weight, they encouraged them to eat more food to maintain their body weight during the course of the study. They used a group of patients, a cohort that was on insulin for type 2 diabetes. And they found that over the course of their 16 days, they were able to decrease insulin dosing on average by 15 units per day. And in 9 patients, they were able to discontinue insulin in that group of patients that were taking between 15 and 20 units per day. And 2 patients that were taking 32 units per day were able to discontinue insulin. So essentially 50% of patients in this study were able to discontinue their insulin on a diet that maximized the foods that would improve insulin sensitivity and biochemical markers, but did not lose weight. And so it gives us, again, a suggestion that it's not just weight loss, but we're actually changing the physiologic parameters of insulin sensitivity. In another study that looked at utilizing a high-fat diet and measuring the intramyocellular lipid content, they compared a normal fat diet with 30% fat, 55% carbohydrate, 15% protein, versus a high-fat diet with 60% fat, 25% carbohydrate, and 15% protein. Physical activity was prescribed in this study, and they measured the intracellular lipid throughout the course of the study. And they found that a high-fat diet resulted in a 54% increase in the intramyocellular lipid concentration. And they saw that there was a change in molecular adaptations that favored greater storage of fat. In another study, looking at a 4 to 5 week intervention of a high-fat diet, they found an 86 to 130% increase in intramyocellular lipid. And they found that the high-fat diet induced endotoxemia, disrupted toll-like receptor 4 and cytokine signaling that are all involved in insulin sensitivity and signaling. And in this study, the high-fruit diet did not induce any of these changes. So trying to answer some of the questions about whether the composition of a plant-based diet makes a difference, they looked at a low-fat vegan diet with lower saturated and trans fats and found that this type of diet resulted in greater insulin sensitivity than a diet that contained more saturated fats. And they noticed that changes in the fatty acid composition were associated with changes in insulin resistance and secretion. Interventional trials have also shown that substituting unsaturated fatty acids for saturated fatty acids lowers the plasma fatty acids and improves insulin sensitivity to a greater degree. And plant-based diets have been shown to be higher in linoleic acid and improve insulin sensitivity. So this study, the broad study, was performed by our friends in New Zealand. It was a prospective 2-arm parallel superiority study run from August 2014 to February of 2015. And they compared medical care, or basic standard of care, with medical care and a dietary change that included a whole food plant-based diet. They encouraged people to eat an unlimited amount of plant-based foods. And they did not include an exercise intervention in this study. And they found that the dietary intervention with a whole food plant-based diet had the greatest sustained weight loss to date in any study that utilized diet alone. And they recognized that this group had the highest satiety levels and satisfaction levels of any group in a dietary intervention. All of the subjects in the intervention trial had improved hemoglobin A1Cs with a notation of 2 reversals, 2 out of 32 patients, and a 29% reduction in medication over the course of 12 months. 2 studies that have highlighted improved insulin sensitivity in a relatively short period of time are first, Neil Barnard et al. 2006, looking at 99 participants. They found a 24% increase in insulin sensitivity in just 14 weeks, and the abnormal blood sugar levels returned to normal. Duniev in 2012 showed that 62% of the participants normalized their blood sugars during the course of the study. The mean number of medications decreased from on average 4 medications to 1. The A1Cs normalized from 8.2 to 5.8. And at the same time, blood pressures also improved, on average from systolic of 148 with a diastolic of 87 to 121 over 74. And as we would expect with an intensive lifestyle intervention, triglycerides improved as well from 171 to 103. More recently, there have been studies looking at improvements in beta cell function through lifestyle intervention and a whole food plant-based diet. Exercise and diet can alter glucose-induced insulin responses, but the studies were looking to see if these changes were just due to improvements in insulin sensitivity or if there was an improvement actually in beta cell function. And they found that with a lifestyle intervention, including both diet and exercise, that insulin secretion increased due to insulin beta cell function. And their conclusions were we demonstrated for the first time that changes in insulin secretion and lifestyle intervention may be mediated by alterations in GIP, which is glucose-dependent insulinotropic polypeptide secretion from intestinal K cells. Another trial looked at 16-week intervention utilizing a low-fat vegan diet and found a significant improvement in beta cell function and insulin sensitivity equal to some of the studies that we have also seen. In another 24-week intervention trial utilizing a plant-based diet and exercise, they found that a calorie-restricted vegetarian diet increased insulin sensitivity, reduced the volume of visceral fat, and improved plasma concentrations of adipokines and oxidative stress markers more than a conventional diet in patients with type 2 diabetes over 24 weeks. The addition of exercise training further augmented the improved outcomes with our vegetarian diet. And so I think this study highlights the importance of a comprehensive approach, utilizing both healthy plant-based diet and exercise, and that the nature and quality of the diet has a greater impact on insulin sensitivity than just the diet that's related to weight loss. And here we can see greater changes in weight and improvements in LDL cholesterol, glucose, and reductions in visceral fat. And further in the study, we can see that an improvement in other and important biochemical markers associated with a plant-based diet, including improvements in superoxide dismutase, reduced glutathione, the changes in leptin, and glutathione reductase and transferase, really highlighting the fact that the plant-based diet is altering inflammatory markers, oxidative stress, as well as hormonal changes. And so it's highlighting the fact that the composition of the diet and the improvements in insulin sensitivity are related to deep biochemical changes and not just weight loss. So let's just take a few minutes and look at some of the varied mechanisms of changes in insulin sensitivity. There have been some interesting studies that have looked at the intramyocellular lipid utilizing imaging. And today, utilizing ultrasound or magnetic resonance spectroscopy, we can visualize the quantity of intramyocellular lipid. In a 2018 systematic review and meta-analysis, conclusion was found that high-fat diets and diets with a caloric intake increased above the amount required to maintain a normal BMI with carbohydrates and short-term starvation. Our short-term starvation diets are associated with increases in intramyocellular fat content. And so this would highlight the fact that a ketogenic diet and even paleo diets today, as well as dieting strategies, may actually increase intramyocellular lipid content, leading to the potentiation of greater insulin resistance. When they added more sucrose or fructose into the diet through beverages, there was also an increase in intramyocellular lipid or IMF content. When it was a lower fat diet, there was no change for the intramyocellular lipid content. We also can see changes in the microbiome associated with our diet, and this is an area that is really beginning to open up in the research with new studies published every week on the impact of diet on our microbiome. And the studies around type 2 diabetes, including this conclusion, found that analysis showed that patients with type 2 diabetes were characterized moderate degree of gut microbial dysbiosis, a decrease in the abundance of some of the types of bacteria that produce butyrate, and an increase in various opportunistic pathogens. And so we are seeing that with these chronic diseases, including type 2 diabetes, there's a disruption of the microbiome with a real dysbiosis or an overgrowth of pathogenic bacteria and a loss of the bacteria that are going to produce the short-chain fatty acids that are important in the maintenance of blood sugars. There's lots of research that we won't go into here, but showing that both a whole food plant-based diet and lifestyle interventions really begin to normalize the microbiome and improve the production of the short-chain fatty acids. One of the studies found that a plant-based diet for 1 year positively impacted the gut microbiome, and it proactively enhanced the protective species that produced short-chain fatty acids like butyrate. And butyrate has been shown to improve the stability of blood glucose over the course of 4 to 6 hours. Butyrate also acts locally to improve the gut health and reduce inflammation locally within the gut. And the study found an improved diversity of bacteria and the prevalence of positive strains like Prevotella. They found also that A1C levels improved and correlated with a greater diversity and abundance in the microbiome. They found with a plant-based diet intervention greater insulin sensitivity and improvement in short-chain fatty acids that enhanced insulin sensitivity, mineral absorption, reductions in cholesterol, and decreased glycolysis in the liver, as well as improved satiety through many, many mechanisms that are highlighted in the microbiome literature. As a part of a comprehensive lifestyle intervention, exercise is also important. And just to highlight a couple of studies and the mechanisms by which exercise improves insulin sensitivity, it appears that through exercise, there's a downregulation of beta cell function due to increased insulin sensitivity. And part of that comes through the increased transport of glucose into cells via an activation of the GLUT4 transporter. And the GLUT4 transporter, again, hearkening back to that first slide, can act independent of insulin and therefore is a very effective means for improving insulin sensitivity. They found that a regular training regimen results in an upregulation of the GLUT4 transporter with increased responsiveness in muscle glucose uptake and insulin sensitivity. And they found also that with exercise, there's a restoration of mitochondrial function and an improvement in the biogenesis of mitochondria. As a part of that comprehensive approach, sleep is important, as covered in one of the other units in this course. However, just to highlight the fact that sleep is an important component of an intensive lifestyle intervention. A 4-year multi-site randomized control trial utilized intensive lifestyle intervention and compared it to the diabetes self-education for people living with type 2 diabetes and obstructive sleep apnea. And they found again that REM sleep improved in the intensive lifestyle intervention, but not in the diabetes self-education group. Intensive lifestyle intervention had a positive change on weight, hemoglobin A1C, and obstructive sleep apnea. So weight loss and not REM sleep was associated with an improved hemoglobin A1C level. This highlights the impact of a comprehensive approach to type 2 diabetes, that sleep is a critical component of a lifestyle prescription. Just a couple of other studies that have looked at sleep intervention in patients with obstructive sleep apnea utilizing CPAP. 59% of the people living with type 2 diabetes demonstrated improved hemoglobin A1C levels and better glycemic control. In a randomized control trial, adolescents with type 1 diabetes, there was an average 7.4% improvement in glucose levels with the addition of 15 minutes to 1 hour of sleep per night. And finally, in an interventional trial that added 1 hour of sleep per day for a total of 6 weeks, they found reduced fasting insulin and improved insulin sensitivity. Stress is an important component of the reversal of type 2 diabetes. And in the stress management mindfulness studies, they've had mixed results just focusing only on stress reduction, and have shown in some studies modest improvements. In general, there's an improved glycemic control of 0.5%, a reduction in blood pressure by 6 millimeters of mercury, and improved depression and anxiety symptoms. However, many of these studies have only utilized stress reduction and mindfulness to improve control of the blood sugars. But as a component of a lifestyle prescription, stress is very important. And we know that stress also is implicated in emotional eating and the predilection to make those choices to eat foods that are high in sugar, high in fat, to mitigate some of the effects of both pain and stress. And so as a component of a lifestyle medicine prescription, stress is very important, despite even some of the modest benefits with stress-only interventions. So in summary, this course has described the criteria for the remission of type 2 diabetes, classified the lifestyle factors that contribute to type 2 diabetes remission, discussed the physiologic changes that restore insulin sensitivity, and listed 4 or more essential components of an intensive lifestyle intervention that will maximize the potential for remission. And I want to thank you so much for joining me for this module. I just wish you all the best.